Finally, we are going to hear from Dr. Lauren Spearing from Tufts University. Dr. Spearing is assistant professor in the Department of Civil and Environmental Engineering at Tufts University in Medford, Massachusetts. She uses a systems thinking approach involving both qualitative and quantitative methods to understand complex problems at the intersection of technical, social, and natural systems. She is currently leading an NSF-funded project to understand community members' impacts related to water and homes after the East Palestine chemical spill and fires. Dr. Spearing, thank you for taking the time to share your study with us. You have the floor.
Thanks, Dr. Wilton, for the introduction, and thanks everyone for spending your time listening to us as we share results from the studies that recently came out. So I'm Lauren Spearing. I'm an assistant professor in civil and environmental engineering at Tufts University. I was formerly at the University of Illinois, Chicago, and so a lot of our outreach for this project was when I was in that position. And today I'm going to talk about our results just published in a paper titled "What Drives Household Protective Actions in an Industrial Disaster? Insights from the East Palestine Train Derailment." This was a collaboration with Joe Tolan, Andrew Welton, who's here today, and then Clayton Wukich, who's also here today. And it was funded by the Humans, Disasters, and Built Environment program at NSF. And so before I dive into the results of this specific study, I want to talk a little bit about the goal of the project overall. It's a bit different than the presentations earlier today. We're going to really dive more into community experiences related to water, air, and home impacts. So we're not focused on the health impacts. And in this project, we didn't do any environmental testing or sampling. Instead, we talked to people and we surveyed people. And specifically, we really wanted to look at the relationship between community perceptions and experiences and actions people took to protect their health. And so why does this matter, right? Why do we need to ask these questions? By understanding challenges that communities faced immediately after disaster and currently, right? We can help inform future response and maybe even policy down the road. And so a lot of what I'm going to talk about today is going to be tailored towards how can we lead to recommendations in the future with the knowledge we have about how this has been impacting community members. And so we collected data in two different ways. We first conducted a community survey from July to September of 2023. And this was done online, in person, and via mail. And so there were flyers throughout East Palestine and the surrounding counties, as well as going to community events and fairs. We ended up with 259 valid survey responses, majority of which were from Columbiana County, which is where the event occurred. But I want to note we took a broader lens to this. And so all the counties shown on the right were eligible to participate. And we actually did get a large percent of the sample from Lawrence and Beaver County, right? So we included both Ohio, Pennsylvania, and West Virginia here. We asked a lot of questions based on previous research, and I have 8 minutes today, so I'm not going to be able to cover everything. And so I'm just going to pick a few select aspects of the survey. We also conducted semi-structured interviews with 53 residents, which allows us to gain deeper insights about the experiences that people had. This was not in the published paper, but I am going to share a few preliminary results from this study. And so how did we approach this, right? How do you actually look at connections between experiences and perceptions and protective action? We did this through statistical modeling, and so we used logistic regression. I'm not going to get into the nitty gritty of the methods used here because I wanted to spend more time focused on the results, but I point everyone to the journal publication, which is open access, and everyone can take a look for more details there. But how we looked at this was first we tried to identify a group of independent variables or drivers. So these are different experiences and factors that could lead people to take certain actions. And so I'm going to provide a couple examples here. Environmental cues are what they sound like, right? So it's what people are seeing in their environment that leads them to make a decision. So an example here is reporting or seeing soot or ash inside their home. Um, Most people actually did not report seeing ash inside their home. But another aspect we looked at was indoor air and odors. And so we actually found that 61% of people reported a new indoor odor after the crisis. We also looked at things like social cues, and this had a lot of different factors we looked at. This could be community engagement and attending community members. And then we also looked at equity and fairness. And I want to zoom in a little bit more and talk about the descriptive statistics. And so the overall results of the survey regarding equity and fairness. If you look at this figure on the bottom here, in orange shows perceptions that were rated very low or low. So this is a percentage of the survey respondents who had viewed each of these factors. And so as you can see, many people rated that they didn't perceive equal access to resources or that people were treated equitably. So that's really talking about access to resources and shows a gap in the resource allocation process. But in the bottom, you can also see, you know, a lot of findings about open decision-making processes and transparent decision-making processes. And what this revealed is procedural inequities, which means that not all groups of people were well represented or felt that they had a voice in decision-making. And so it's not just about access to resources in the end, but also whose voices are heard and who's able to be involved in decisions. Again, we looked at a lot of other independent variables aside from the ones I talked about today, but I'm going to zoom in on just a couple, and we'll point you towards the paper for more details. In terms of dependent variables, we ran 3 different models. One on requesting sampling and testing, one on relocation, and one on the use of air filters. Today, I'm just going to zoom in on requesting sampling and testing. And so what we found is that 50% of participants requested some sort of air, water, or soil sampling. And of those who requested the sampling, 62% received sampling and results. But I want to point your attention to these figures on the right of this slide. We found that 73% of people who received results said they were unclear, and 75% said they did not trust the testing. And so what that's showing is the importance of clear communication of sampling plans, methods used, and limitations. And so I'll get back to this and we'll talk about it more in depth. One other thing we found regarding sampling and testing is that many people were financially impacted by paying for testing, right? So maybe hiring a consulting firm to come in and test their well water if they were concerned about safety. That creates a financial burden on households. So what did we find, right? What were the model results? And I'm not going to walk through every single one of the significant drivers, and I'm just going to point out a couple. We found that environmental cues did play a factor, as expected. And so what this is saying here is that people who noticed soot inside their home tended to request air, water, or soil sampling, right? This makes sense, right? So you're seeing an issue in your home and you're asking and requesting more information. We also found that social cues played a factor, specifically that perceptions of equity and fairness did. And so people who found that or thought that equity and fairness were rated low tended to request air, water, or soil sampling. And what this could be indicating is that people were seeking more information because maybe they felt the processes were not done equitably or fairly. We also found risk communication come into play, right? So if people were told to evacuate by officials, they tended to request some sort of air, water, or soil sampling and testing when they returned. And so I just overviewed the survey responses, right? So we're able to see these relationships, but not as much dig deeper and understand people's stories and some of the more details. And so to help fill those gaps, we conducted these semi-structured interviews. So this isn't in the paper, and I'm just talking about some preliminary results here. But what it is we actually talk to people transcribe the interviews, anonymize them, and then go sentence by sentence, looking at what themes emerged. And so this is a lot more inductive, is what we call it. And so these aren't the ideas that we placed on the interviews, but instead it's what emerged from our conversations. And so in terms of experiences, there was a lot of discussion about water quality and outdoor air quality, right? People oftentimes were concerned about the safety of their well water, especially over time, and what that looks like to monitor going forward. We also found concerns about resource and information access. And so an example quote here, someone said that being outside of the evacuation zone, I feel like a lot of the resources or the information is just focused on East Palestine and not the surrounding area as much, right? So seeing kind of discrepancies in resources available based on if you were in the evacuation zone. We also saw concerns around sampling and testing reflected in the interviews as well as the survey. If you note here, this looks like the frequency is a lot lower, right? So under 50%. And that's just because not everyone had sampling and testing done at their home. So this is expected that we saw a lower frequency of interviews that mentioned challenges regarding sampling and testing. And so people mentioned that the results were unclear. One quote of this is talking about fact checking, saying that I can't fact check it and make sense of it. I know I can't do that with the chemicals because there's too many of them, right? So a lot of people were talking about the burden of trying to understand the results and see what they can do to protect their safety and their home. There were also challenges around the communication of limitations. One quote says, I think that they could have done a better job at that, being able to say that these were the things we don't have knowledge of and recognizing limitations as far as sampling, right? And so this really goes down to clearly communicating sampling and testing. And so I'm just going to go over two key recommendations and takeaways. There's more in the paper as well as in a community report that we released last year that is also included in the supplemental information of the journal publication. So you should be able to find all this information with the DOI that Dr. Welton had on his initial slides and that are on my slides as well. But the key recommendations are first, to standardize testing protocols and to ensure timely and transparent sampling and equitable resource access for residents who request testing, right? So there were a lot of barriers discussed of people having access to information about their safety. And without that, it's hard to know what actions to take to protect their health, their home, and their families. We also recommend strengthening the hazard identification protocols and developing clear guidelines for communicating complex scientific data in environmental disasters, right? There's a lot of decisions that have to be made and a lot of complex information that has to be communicated. And so a lot of this is removing the burden of trying to understand and parse through complex results from the homeowners and the community members, to really clearly say, this is what's happening, these were the limitations of the testing, and this is what we recommend to be done. So I want to end by really acknowledging everyone who participated. It takes time, right, to talk to us and to complete a survey. And we really appreciate you taking the time to do this and allowing us to hear your stories. Again, here's the link to where this is published. We also have a website that has the information, and feel free to reach out to me with any questions.